Rachel Holweg, and this is my dad, Mike Holweg. We're the authors of the Pain-Free Foods program. And so today we're going to be talking about some specific diverticulitis symptoms that clients deal with on a regular basis and some solutions for those. What would you say are the most common symptoms in coaching that we deal with that clients ask about?
I think we have four main symptoms that we hear about all day long, and they amount to pain, bloating, bathroom issues like diarrhea and constipation, and then a fourth symptom, the side effects of taking the various medications such as antibiotics and Ascol and just the different medications that are prescribed, steroids and other things that doctors prescribe for people who are suffering. Medicinal side effects. Rachel and I believe that most synthesized medicines, like what gets prescribed by doctors, and even including antibiotics, have a series of negative effects on the body. Now, we are not doctors, and we're not trying to override what your doctor tells you. We're just telling you what we think about medicines in general, not telling you to stop taking them. However, if you go to some of the forums that discuss these digestive disorder medications, such as Cipro and Flagyl, Ascol, and the various steroids, you will be scared out of your mind. You'll read about patients who became so sick or had such severe symptoms that they stopped taking the drugs and so forth. And we're not suggesting that you do that. We're suggesting that you do your homework, do your research, and do what's best for you in conjunction with listening to your doctor's advice.
The other two side effects that a lot of clients complain about whenever they give us a call are pain and bloating. Most people that have a digestive disorder will have some severe bloating after meals to where their stomach starts to feel distended. And in addition to that, a lot of clients either have constipation or diarrhea. And it doesn't seem to be specific to your digestive disorder specifically. You can have diverticulitis and you can have severe constipation, and you can have diverticulitis and have severe diarrhea. And so one of the things that we do when a client calls us or when a client is on our program and we work with them, we have specific protocol to help with all of these different symptoms. Obviously, now if we're talking about something that's related to the medicine that you are taking, that's going to be between you and your doctor. But when it comes to any kind of bathroom issues, bloating, or pain, that's what our diet specifically addresses. We've just finished writing a free report, and if you click on the link at the bottom of the page, we actually have some specific protocol for ending a flare-up quickly. That includes the pain and the bloating, so any kind of cramping and or bloating. And we also address constipation and diarrhea. Those usually take a little bit longer to sort out. Those aren't an overnight solution. A lot of times pain and cramping are one of the first things to go when you start our program. But for most clients, not in all cases, but for most, constipation and diarrhea are not an overnight fix. So as you get started, you have to expect that. Just based on client reports, you will see progressive improvement, but it's not an overnight solution. If you're not willing to change your diet and you're not looking for any kind of diet, we have developed a lot of different solutions that help speed up the process with our diet that you can find at your local health food stores. Dad, I want you to tell us about some of the things that we've discovered.
We don't like to just talk about digestive disorders. Rachel and I were all about the solution. In order to kind of maintain our credibility, one of the things that we insist within our family and our company is that when we come up with a solution, we tend to give it to you for free. If it's a product, there are several supplements that really help with these specific symptoms that we've mentioned today. If it's a product, although I used to sell these supplements and products that I would recommend on the website, I've discontinued that. Rachel does have a website that offers the products that I recommend. Her website is called rachelstea.com. We also always give you the exact product, brand, description, formula, cap count, and so forth, so that you can go get the product locally. So if you're in pain immediately and you need to have something in your hand in an hour, we give you a way to do it. If you can find it more inexpensively, more reasonably than we offer it for, or Rachel does, you can go find it yourself. If, for instance, with our tea, which is our #1 product for some of the symptoms we've described here today in this video, we give you the exact recipe. We do not want you to feel like you're linked to us, that you have to purchase from us, or that we are recommending things because we sell them. We want to keep ourselves divorced from that, keep that very separate. But over the years, we have found that a lot of clients have trouble sourcing all of the different things, so we do offer at least one way for them to get them when nothing else works. My daughter's website is rachelstea.com. There is a free report that covers a lot more than we've discussed in today's video. Just grab it for free, check it out, and you may find that you can eliminate some of your symptoms either with some products you source locally or with the report that you can download in a minute. The link is given at the bottom of this video. Thanks.